I'm Ilaria from Vichy Laboratoire, and today we are at the VIC, the Vichy Integrative Conversation podcast. There is a special guest with me today, that is Paula from our Vichy International Pharmacist Board. Paula, can you introduce yourself?
Thank you, Ilaria. I'm Paula, I'm from Spain. I'm a community pharmacist, and I also do a lot of work in Instagram and LinkedIn.
Thank you, Paula, for your introduction. And today, in this small podcast, I want to discuss with you about the problem of people related to hair. Which is the most frequent hair problem that you see every day in the pharmacy?
It's dandruff. It's incredibly prevalent, affecting people in all ages. Sometimes patients come knowing they have dandruff and they are looking for a solution. Other times they describe symptoms. It's scalp, flakes, redness, without realizing it's dandruff. Frequently they have used some treatments, but they stop when they improve because the cosmeticity is not really good and they relapses. That's where our pharmacist role becomes important because we can identify these symptoms and recommend an appropriate treatment and hopefully preventing it from developing into a serious condition. Of course, we can guide them toward effective OTC solutions.
Yeah, it's true that honestly your recommendation is very important every day at the counter to prevent relapses, to prevent them to develop more serious condition. So every day you can literally twist their quality of life and improve their quality of life. And from what you're telling me, the dandruff is very prevalent everywhere. There is a lot of people coming every day with dandruff at the pharmacy. But do you think that there are also some myths, like fake news about dandruff?
Absolutely. Patient education is a huge part of what we do as a pharmacist. You know that the people who are having healthier diet reduce their risk of dandruff in 25%. Also, there are so many myths about there. And it's important to set the record straight. For example, some people believe dandruff is caused by poor hygiene, which isn't true at all. Indeed, the pathogenesis is indeed multifactorial. Dandruff is exacerbated by internal and external factors like genetic predisposition, physical or emotional stress, hormonal changes, dietary, alcohol, smoking, and that lead to a global disequilibrium, such as imbalanced microbiome, modified sebum composition, and altered barrier functions. It stems from a disrupted skin cell turnover process. Poor hygiene might make dandruff worse, but it doesn't cause it at all. Clearing up these misconceptions and really make a difference in how people manage dandruff.
This is very interesting. I think that everyone should know about these things because honestly dandruff is so common and there are such a lot of myths, and it's very interesting what you are telling to us today. Thank you so much. And when you face this issue at the pharmacy, do you have like some preferred ingredients that you want to use, that you know that they are effective to treat the dandruff of your patients? And would you like to share about these ingredients with our community?
There are several effective options available. Some of these are available over the counter in some countries, but you need prescription in other countries. Some of these treatments have a downside because many patients find it harsh on their hair, leaving it dry and dull. Personally, I often recommend selenium disulfide, the key ingredient in Dercos DS. Dercos DS contains also salicylic acid, vitamin E, and ceramide. That works. It also effectively reduces itchiness, flaking, and even hair greasiness. It rebalances the scalp microbiome, exfoliates the scalp, and prevents relapses. That's very important. You know that it's very important that the recommendation doesn't compromise the look and the feel of their hair. The cosmeticity is very much appreciated by the patients, which is important for better compliance to the treatment. Make it simple and effective. That's the best choice.
I really much agree with you because it's true that if patients don't like how the product stays on the hair, they will stop to use it. So it's key for an anti-dandruff product literally to maintain the quality of the hair. So we look for effective but yet very cosmetic products.
It needs to be easy anyway.
It should be very easy, yes, for the pharmacist and for the patient. Thank you very much to share all your expertise with us today. And if you want to know more about not only dandruff but other topics, you can check our mini podcast series. This is VIC, Vichy Integrative Conversation.